One wrong Medicare decision can quietly cost you thousands, sometimes every single year in retirement. And the scary part? Most people don't even realize they've made a mistake until the bills start piling up. Are you choosing the right plan or just the most familiar one? In the next few minutes, I'm breaking down 5 costly Medicare mistakes that can drain your savings and exactly how to avoid them so your retirement money lasts longer. Missing your Medicare enrollment deadlines can trigger permanent penalties and coverage gaps. Medicare has strict timelines, and the most important is your initial enrollment period. A 7-month window that starts 3 months before the month you turn 65, includes your birthday month, and ends 3 months after. If you miss it and do not have qualifying employer coverage, you may face a Part B late enrollment penalty of 10% for every 1-2 month period you delayed, and that penalty lasts for life. For example, if your Part B premium is $175 per month and you delay 2 full years, you could pay about $210 per month forever. There is also a Part D penalty for late prescription drug coverage, calculated monthly and added to your premium permanently. Beyond penalties, you might have to wait until the general enrollment period, January 1 through March 31, with coverage not starting until July 1, leaving you uninsured for months and exposed to large medical bills. A single hospital stay can easily exceed $20,000, which could devastate a retirement budget. The safest move is to mark your calendar well before age 65. Confirm whether your current employer plan qualifies you for a special enrollment period, and enroll on time. If you are still working and covered by a large employer plan, verify with HR that your coverage is creditable to avoid penalties. Taking action early keeps your premiums lower and your coverage continuous. Assuming original Medicare covers everything can leave you exposed to significant out-of-pocket costs. Original Medicare, which includes Part A for hospital and Part B for medical services, does not have an out-of-pocket maximum and generally covers about 80% of approved services after deductibles. That means you are responsible for the remaining 20% with no cap. If you undergo a surgery that costs $50,000, your share could be $10,000 or more. Part A also has a hospital deductible, which in recent years has been over $1,600 per benefit period, and daily co-insurance for extended stays. Many retirees are surprised to learn that routine dental, vision, and hearing services are largely not covered, and long-term care is not covered beyond limited skilled nursing conditions. To avoid a financial shock, you should evaluate either a Medigap policy, which helps cover deductibles and co-insurance, or a Medicare Advantage plan that typically includes an annual out-of-pocket maximum. For example, a Medigap Plan G might cost $150 to $250 per month, depending on your state and age, but it can dramatically reduce unexpected bills. The key is to compare premiums against potential risk and choose a plan that aligns with your health needs and budget rather than assuming Medicare alone is enough. Ignoring prescription drug coverage can result in lifelong penalties and high medication costs. Medicare Part D is optional in name but essential in practice, because if you do not enroll when first eligible and you lack other creditable drug coverage, you will face a late enrollment penalty that is added to your premium permanently. The penalty is calculated as 1% of the national base beneficiary premium for every month you go without coverage. So even a delay of 24 months can meaningfully increase your monthly costs for life. More importantly, prescription drugs can be extremely expensive. A common cholesterol medication might cost $30 per month with insurance, but over $200 without it, and specialty drugs can run thousands per month. Many plans also have formularies, tiers, deductibles, and copays, so choosing the wrong plan can mean paying far more than necessary. For example, one plan might have a $0 premium but high copays on your medications, while another with a $25 premium could reduce your total annual cost by hundreds or thousands. The smart approach is to review your medication list each year during open enrollment, compare plans based on total annual cost rather than just premiums, and ensure your pharmacy and drugs are covered. Skipping Part D, or choosing blindly, is a costly mistake that compounds over time. Choosing a Medicare plan without comparing total costs can lead to paying more than necessary each year. Many people focus only on the monthly premium, but that is just one piece of the puzzle. You need to consider deductibles, copays, co-insurance, provider networks, and out-of-pocket maximums. For instance, a Medicare Advantage plan with a $0 premium might seem attractive, but if it has a $7,500 out-of-pocket maximum and higher copays for specialists, you could end up paying much more if you have ongoing health needs. On the other hand, a plan with a $100 monthly premium and lower cost sharing might save you money overall. The same applies to Medigap policies, where higher premiums often mean lower out-of-pocket exposure. It is also critical to check whether your doctors and hospitals are in-network, because going out of network in some plans can result in significantly higher charges or no coverage at all. A practical way to compare is to estimate your expected healthcare usage for the year, including doctor visits, prescriptions, and potential procedures, and calculate your total annual cost under each option. Medicare's plan comparison tools or a licensed advisor can help you model these scenarios. Making a decision based only on premiums is like buying the cheapest car without considering fuel, maintenance, and insurance costs, and it often leads to regret. Failing to review and update your Medicare coverage annually can cause you to overpay or lose needed benefits. Medicare plans are not static, and each year during the annual enrollment period from October 15 to December 7, insurers can change premiums, deductibles, formularies, and provider networks. A plan that worked well last year may become more expensive or stop covering one of your medications. For example, a drug that was on a preferred tier with a $10 copay could move to a higher tier with a $75 copay, increasing your annual cost by hundreds of dollars. Similarly, your doctor might leave the network, forcing you to switch providers or pay more. If you do not review your annual notice of change, you could be caught off guard in January. Taking an hour each fall to compare your current plan with alternatives can result in significant savings. Even switching from one Part D plan to another could reduce your annual medication costs by $500 or more depending on your prescriptions. You should also reassess whether your health status has changed and if your current plan still fits your needs. Staying passive with Medicare is expensive, while staying proactive helps protect your retirement savings from unnecessary healthcare costs.